My name is Lance. I am 42 and I have a condition called Hereditary Hemorrhagic Telangiectasia, or HHT for short. Myself and my two daughters, actually. We were all diagnosed 2 years ago after I started having some health issues. We have a lifetime of monitoring for our health. MRIs on the brain and the liver every few years, and something called bubble echocardiograms for our lungs, and if needed, CT scans. And that's all to be sure that we don't have something called arterial venous malformations, otherwise known as AVMs. I have had 3 surgeries in my lungs because of it, to prevent things like brain abscess and stroke, because these AVMs, they act like shunts. And so with HHT, we need a lifetime of monitoring and care and diagnostics to be sure that we don't have these complications. That's because with HHT, it's a blood vessel disorder that causes bleeding. Its most common symptom is nosebleeds, but you can have no visible symptoms. Although I have it affecting my lungs, it could someday affect my brain or my liver. I can have complications due to my bleeding, and my 2 daughters can have it completely different from how I have it. One family member can have issues in one area and another person completely in another area. People have multiple surgeries throughout their lives to fix these problems. Some people even have to have lung transplants. And one person in our community has had a double lung transplant and a liver transplant as a result of that. And a couple little boys that I know have brain involvement, and they've had to have, well, one has had a couple surgeries, expected to have more, and one is on his way to find out if he's going to need brain surgery to treat these things. So if you're not aware of HHT, now you are. We appreciate you getting to learn more about this, and hopefully those someday that are affected by this will learn about it, because unfortunately, because the symptoms aren't always visible, it can go undetected. In fact, it's estimated about 80% of the population who have HHT are undiagnosed, and because of the way that it functions, it affects families. It's estimated that 1 in 4,000 to about 1 in 5,000 people are affected, so it's pretty common. Thanks for watching.